Welcome. Have you ever felt like food is getting stuck in your chest? Today, we're diving deep into achalasia, a rare disorder that makes it difficult for food and liquid to pass from your esophagus into your stomach. We'll explore what causes it, how it affects the body, and what can be done about it. So, let's unravel the complexities of achalasia together. The exact cause of achalasia remains somewhat mysterious, but we know a few things. It's believed to be an autoimmune disorder, meaning the body's immune system mistakenly attacks the nerve cells in the esophagus. These nerve cells, specifically those within the myenteric plexus, are crucial for coordinating muscle contractions needed to push food down. Genetic factors may also play a role, making some individuals more susceptible. In some rare cases, achalasia can be caused by infections like Chagas disease, which is prevalent in South America. Now, let's talk about how achalasia disrupts the normal digestive process. The lower esophageal sphincter, or LUS, is a muscular ring at the bottom of the esophagus that relaxes to allow food into the stomach. In people with achalasia, the LUS fails to relax properly, remaining tightly closed. Adding to the problem, the esophagus loses its ability to perform peristalsis, the coordinated wave, like muscle contractions that propel food downward. As a result, food and liquids accumulate in the esophagus, leading to a variety of uncomfortable symptoms. Achalasia is a relatively rare condition affecting about 1 in 100,000 people each year. It can occur at any age, but it's most commonly diagnosed between the ages of 30 and 60. There's no significant difference in prevalence between men and women, and it affects people of all ethnicities. The symptoms of achalasia can develop gradually and vary in severity. The most common symptom is dysphagia, or difficulty swallowing, which can affect both solids and liquids. Many people experience regurgitation of undigested food, sometimes even hours after eating. Chest pain is also a frequent complaint, often described as a squeezing or burning sensation. Other symptoms include coughing, especially at night, heartburn, weight loss, and even aspiration pneumonia, which occurs when food or liquid enters the lungs. Diagnosing achalasia involves a combination of tests. Esophageal manometry is the gold standard. It measures the pressure and muscle activity within the esophagus, revealing the characteristic lack of peristalsis and failure of the LUS to relax. An upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus, can rule out other conditions like tumors or strictures. A barium swallow study, using X-rays to visualize the esophagus after drinking a barium solution, can show the narrow luminescent dilation of the esophagus above it, often described as a bird's beak appearance. While there aren't distinct subtypes of achalasia based on etiology, it's often classified based on manometry findings. The Chicago classification divides achalasia into 3 types based on esophageal pressure patterns. Type I, a classic achalasia, demonstrates no peristalsis. Type I shows pansophageal pressurization, and Type II displays spastic contractions. This classification is important because it can help predict the response to different treatment approaches. Unfortunately, there's no cure for achalasia, but several treatments can effectively manage the symptoms. Medications like nitrates and calcium channel blockers can sometimes relax the LS, but their effectiveness is limited. Pneumatic dilation involves inflating a balloon inside the US to stretch and weaken the muscle. A Heller myotomy is a surgical procedure where the muscles of the LS are cut to relieve the pressure. A more recent advancement is PAM, or peroral endoscopic myotomy, a minimally invasive procedure where the myotomy is performed through an endoscope inserted through the mouth. The best treatment option depends on individual factors like age, overall health, and the severity of symptoms. After treatment, lifestyle adjustments such as eating slowly, chewing food thoroughly, and elevating the head of the bed can also help manage symptoms. Since the exact cause of achalasia is unknown, there's no definitive way to prevent it. However, if achalasia is secondary to Chagas disease, prevention strategies targeting the parasite responsible for Chagas disease are relevant. Early diagnosis and treatment of achalasia can help prevent complications and improve quality of life. With proper treatment, people with achalasia can often experience significant symptom relief and a good quality of life. The prognosis depends on the individual's response to treatment and the development of any complications. Ongoing research is focused on understanding the underlying causes of achalasia and developing more effective treatments. Areas of study include identifying specific genes that increase susceptibility, exploring novel drug therapies that can target the LS, and refining surgical techniques to minimize invasiveness and improve long-term outcomes. We've made great strides in understanding and managing achalasia, and the future holds promise for even better treatments.